The army is here to help in the fight against a small but powerful foe, the Aedes aegypti mosquito, responsible for the transmission of serious diseases like dengue and chikungunya. The army's mission, working alongside public health officials, is to go from house to house, looking for signs of the mosquito's larvae or their nesting spots. Small amounts of clean still water in a flower pot or a no tire, for example, can provide the ideal environment for the larvae to develop.
Dengue and chikungunya are well-known problems in Brazil, two viral infections hitting every year with different degrees of intensity. This season, they are peaking in this region, putting more pressure on a healthcare system already overwhelmed by the COVID-19 pandemic.
Through March, in the 9 cities of the Baixada Santista, the region around the port seat of Santos, there were almost 1,400 confirmed cases of dengue, nearly 2/3 of the total for all of last year, and the numbers are rising. The worst hit city is Sao Vicente, with more than 400 confirmed cases, and another 1,000 which health authorities say are likely to be confirmed. The chief of the department responsible for dengue control says the pandemic limited the capacity to work on prevention last year.
A nossa entrada nas casas foram muito dificultadas nessa época.
Entering homes was more difficult for health and safety concerns, both for the people who live in the houses and for our agents. Now we are managing to do it because we have the assistance of the army and because all our agents have been vaccinated. This allows us to work with more safety.
In this family, 2 people have been infected this year. It's just another concern amid the COVID-19 pandemic.
Me prevenindo, tipo, Covid, álcool, máscara, né, essas coisas.
I pay a lot of attention to prevention against COVID-19, like wearing a mask and using hand sanitizer. And against dengue, I use insect repellent all day, and also advise my daughter, my husband, and my friends to use repellent too.
Doctors say one problem is that early symptoms of dengue and chikungunya are similar to those of the coronavirus.
A partir do 3º dia, o diagnóstico é bem mais fácil.
We can differentiate the diseases more clearly only after the 3rd day. COVID-19 has more respiratory symptoms. In the case of chikungunya patients, it's pain in the joints. More diffuse symptoms like lower fever, diarrhea, and some pain in the joints indicate dengue.
It's unlikely the diseases carried by the Aedes aegypti will ever be eradicated in Brazil, but health authorities say they can be controlled with careful work and the essential help of the population to eliminate the mosquitoes' nesting grounds. Paulo Cabral, CGTN, São Vicente, Brazil.